The reason that we started Action4Diabetics is because we had realized, Jerry and myself, who's the co-founder, that people were dying of type 1 diabetes in Southeast Asia. When we realized that from our own country in the UK, that there are even international sports people performing to the highest level who suffer from type 1 diabetes. The situation regarding diabetes in the world and in Asia now is a very serious one. In fact, according to the WHO, it's a global epidemic, and this year there'll be an estimated 500 million people suffering from diabetes around the world, of which 200 million are here in Asia. Type 1 diabetes tends to exhibit in young people between the age of 5 and 15, and this is the time that they're most likely to contract type 1 diabetes. In a situation where a type 1 diabetic does not have access to insulin, they are very unlikely to survive more than 6 months. There are a number of serious complications associated with diabetes, which are life-threatening and can also lead to death. The principal ones are loss of vision, kidney damage, heart damage, also brain damage, and can actually lead to an individual going into a coma, and the coma can itself be deadly and they may not recover and will die. Our mission at Action4Diabetics is to save and transform the lives of young people with type 1 diabetes in Southeast Asia. The countries we focus on are Myanmar, Thailand, Laos, Cambodia and Vietnam, and this year, 2018, we're going to open 2 new sites in Malaysia. In the case of a poor family, learning they have a type 1 diabetic child is really a devastating experience. They'll be informed that that child will need to self-inject with insulin and manage their blood sugar for the rest of their lives, otherwise they will die and unlikely to survive childhood. There's a very practical issue as well, is that of cost, and the families often cannot afford to buy the insulin and buy the essential medical supplies required. This could cost them anywhere between $40 to $50 per month, which is completely impossible for a poor family to afford. In addition, we find with some of the children on our program, they literally live hundreds of kilometers away from the hospital that can provide support. So there's a massive physical barrier towards them getting support from doctors that they require, particularly in the early stages when they've been newly diagnosed. There are a number of programs that we have developed at A4D. The first one, and our cornerstone program, is the provision of insulin and blood testing equipment to the type 1 diabetic children. Often, if they had to pay for this themselves, this would cost them $40 to $50 a month. We provide that totally for free. We also organize diabetes family camps, which are 2 or 3 day programs when the children and the families come together, along with the healthcare professional teams that are responsible for managing them. And we conduct a whole series of educational activities, workshops. We also have a lot of fun. We do arts and crafts, we do sport with the children. It's a great opportunity for them to learn more about how to live life to the full with type 1 diabetes, and also for the parents to get to know each other and exchange experiences and learn from each other and realize that they're not the only people in the world whose children suffer from type 1 diabetes. These programs are very inspirational, and we get fantastic feedback from both the parents and the children when we run the programs. Another very important program we have established in 2017 is Sponsor a Child program. This enables an individual or a company to provide financial support, which will cost $500 per year. And for that amount of money, we will guarantee to provide the essential medication and support that the child needs to survive for 1 more year, despite the type 1 diabetes. Our objective by the end of 2018 is to have 375 type 1 diabetic children on our programs across Southeast Asia. Also to enroll 100 type 1 diabetic kids onto the Sponsor a Child program. In addition, we have initiated a scholarship program for university and college support, and we want to have at least 5 young people enrolled in that program in 2018. One way in which we engage with companies is that we can link up with their own corporate social responsibility programs. So for instance, for some companies, we have gone and made a presentation to the staff about our work and explaining about diabetes and about the challenges that young people in their country face if they're suffering from type 1 diabetes. Those companies can also send staff to become actively involved and support us as volunteers at our diabetes family camps, where we'll train them up and give them some specific responsibilities to actually be actively involved at one of our diabetes family camps. My final message to people watching this video is, please help us. There are people dying across Southeast Asia from type 1 diabetes. It doesn't have to be that way, and you can help prevent that situation. So by donating generously to our various activities or volunteering to come and help us in some of our programs in Southeast Asia.